Hi, in Module 1, we will talk about the fundamental concepts in public health, such as the definition and the history of public health, the difference between public health and medicine, and how public health has become specialized, as well as the 5 main pillars of public health. So I'm asking you this question: what comes to mind when you read the word public health? Screening children from nutrition deficiencies, or prenatal education for expectant mother, or quarantine practice to isolate the Ebola disease in West Africa, or the disease transmission prevention after Hurricane Katrina in 2005, or the physical activity promotion to lower the burden of chronic disease? If you answer yes to all of these questions, you are correct. Public health is all this and more. By verbal definition, public health is a field that encompasses many disciplines in an effort to promote and protect health and prevent disease and disability in defined population and communities. In other words, the public health is the science and practice of protecting and improving the health of a community, as by preventive medicine, health education, control of communicable disease, application of sanitary measures, and the monitoring of environmental hazards. Okay, so you may ask this question. Then, what is the key difference between public health and medicine? Although medicine and medicine training are integrated to public health, medicine is more interested in treatment of and cures for disease and disabilities in individuals. Public health, on the other hand, traditionally has focused less on individuals and treatment, but more on populations and prevention. Just keep this in mind. Public health deals with populations, clinic health deals with individuals. This distinction should be made clearly here and throughout the course. So clearly, public health should be focused on problems that affect or could affect a substantial portion of the population. When it comes to the specific public health issues related to physical activity, we usually focus on the physical activity measures, correlates and determinants of physical activity behavior of specific populations, and physical activity interventions, and so on. So next we talk about the defining moment in public health. Like medicine, public health evolved from a variety of reasons, responding to disease of unknown origins and trying to prevent this disease in populations are two main influences on the development of public health. The earliest route of organized public health emerged in middle 14th century. At that time, the Black Death ravaged Europe, killing an estimate of 25% of its population. As known today, the disease was tied to the black rat, the rat flea that live on blood of the black rat. Advances in transportation around Europe and the Middle East spread the disease to other areas in the world. Although no one knows when and how disease would strike, public health was advanced by the creation of health boards and systems for counting and collecting the deaths. This was the first attempt at a valid statistic system, which is non-routine in public health organizations. Although 150 years in the past, infectious disease was the leading concern and primary cause of sickness and death. In the 19th century, infectious diseases were the major public health concerns, yet the health of workers and deplorable working conditions brought to people's attention. Also, the association between poverty and health was recognized, and policies and programs to address such disparities began to emerge. Leaders started to adopt policies and legislation to improve health by improving the sanitation, housing conditions, worker safety, and garbage disposal practices. In the early 20th century, with the legitimization of germ theory of disease transmission in the 19th century, new methods of treating and preventing disease emerged. Sanitation, quarantine, and other approaches for controlling infectious disease became standard practices. The 20th century represents a bridge between a focus on infectious diseases and a focus on chronic diseases. Once infectious diseases were becoming less influential, nutritional diseases became a priority. In the 1950s, individuals witnessed the emergence of chronic diseases as a result of the decline of infectious disease. Today, the chronic disease or non-communicable disease influenced by lifestyle and genetics are the greatest public health concern. This remarkable transition in public health coincides with the beginning of the physical activity story. As you can see from Table 1, the top 10 leading causes of death in the world in 2008 were heart disease, stroke, respiratory infection, pulmonary disease, diarrhea disease, HIV, AIDS, tracheal bronchus and lung cancers, tuberculosis, diabetes, and road traffic accident. So as we can see very clearly here, the vast majority of the chronic disease are related to the lifestyle of individuals. Let's check the updated 10 leading causes of death in 2017. So as we can see, the top 10 leading causes last year was still heart disease, stroke, respiratory infection, pulmonary disease, the non-bronchial cancer, diabetes, Alzheimer, diarrhea, tuberculosis, and road accident. So pretty much the same as 10 years ago. In particular, the first three categories account for more than 50% of deaths among the top leading causes of death. In those three categories, the heart disease, stroke, and respiratory disease would account for more than 30% of the deaths in the world. Alright, next I would like to talk about the areas of specialization in public health. In other words, we need to know the 5 pillars of public health, which are epidemiology and disease control, environmental health, health promotion and health education, health administration and policy, as well as biostatistics. Epidemiology and disease control is a basic science of public health, and it is a quantitative scientific discipline that relies heavily on statistics and study design. Where the environmental health refers to all that is external to the host organism, including the physical, biological, and cultural influences, such as the social environment we live, the physical environment we live, the social environment like social support, family support, peer support that affect our behavior. Biostatistics provides the basics for the quantitative branch. And the health administration and policy is the fourth pillar of public health and focuses on the delivery of public health services. Finally, the health promotion and health education refers to how individuals deal with their behavior beyond the environmental effect and the genetic makeups. Currently, the University of Minnesota at Twin Cities has the formal four pillars: the biostatistic, environmental health science, epidemiology and community health, and health policy and management. Some other universities, like University of South Carolina, this university has the health promotion and health education department. So it varies from university to university, but essentially we should know that there are 5 major pillars on the public health.